everyone. Welcome to the live podcast recording of the Rofi Collective podcast. So, we are live on YouTube, Instagram, and LinkedIn. Thank you for joining me tonight. We're just making sure that we are live on all platforms, which we are. Perfect. Okay, so today's topic is going to be great. It's going to be very interesting, I think, in my humble opinion. And so feel free to share this with at least 10 people that you know. And without further ado, let's get started. So, my name is Larissa Sam. I am a physician, I am a writer, I am an entrepreneur. I own a platform called Rofi, Rophe, Rofi, which means restoration or means healing in Hebrew. It's another spelling for Rapha, actually, Jehovah Rapha. And so, frankly, I exist to bring the healing dimension of God to the earth, and everything we do centers around that. So, we help people lose weight. We help people get their lives back together, body, soul, and spirit, after they've had things like cancer, had a lot of babies, currently pregnant. In fact, wherever in life you find yourself, there is something for you that's available at Rofi. So if you've been struggling with any diagnosis, high blood pressure, diabetes, you're looking for some help, looking to get off medication, but you want to make sure you do this in a safe an organized way, then I truly believe that Rofi is the right place for you. Within the first year of private practice, my clients lost an average of 10 to 15 pounds of weight per month. And they lost over 500 pounds in the first year. So if you're looking for a place which will help you reach your health goals, I think that this is the right choice for you. Tonight, I want to talk to you about MedSpas because this is one of the things which I'm very excited about, but I'm going to be pushing a lot more that we do at Rofi. Fun fact, from the very beginning, vitamin injections, chemical peels, these are things that I've always been interested in and have actually done since the beginning of Rofi back in 2024, beginning of 2024. But what we are going to do is actually push even more. And I'll talk about some of the things which we will do at Rofi and things which we probably will not do. But before I go any further, I'll just share my brief disclaimer, which is that everything I share will be for educational purposes. None of this is intended to be formal medical advice. I do encourage that you always consult with your physician before you do any protocols, start any supplements, frankly, do anything health related, right? And we are always accepting new patients, new clients at Rofi. So if you're looking for a place, feel free to send a message. All right, so med spas. I've always been interested in beauty in some way, shape, or form. From as young as 8 years old, you may have heard my story before, but I'm self taught in how to do hair. I would watch them do my sister's hair, practice on my dolls, and just like that, the skill started to grow. Not knowing was actually a gift from God. Fast forward several years, I was making my own products, making my own at home um, hair masks, deep conditioners from natural products, avocado. I used to do all sorts of things. Went on to college. I ended up in college studying biology. That was my major. And my capstone research was actually on hair curliness, a genomic analysis of determining what the cause of variation in hair curliness was. And so as I did that research, essentially I was able to identify a gene by the grace of God that actually is associated with this differentiation that we see in some people having curly hair versus coily hair versus straight hair versus fine hair. What exactly causes this variation and curliness? You know, the Lord is even just reminding me that my evolution, I had to take an evolution class, which is actually always a very controversial topic among scientists, but I took the class and I loved it. And people say that it's a class that tends to draw you away from God. But for me, I could see the creation story throughout personally. So when I took my class in evolution, I also had to do a capstone. And I've never shared this publicly, but my capstone in undergrad in evolution was actually on facial attractiveness. facial attractiveness. What is it that causes a person to find one person versus another person attractive in the face? In the face. And how has this evolved over time? How has it, thinking of it from an evolutionary standpoint? So it's amazing to take a step back and think, wow, so I was doing hair as a hobby, turned into a business, formulating products. I started formulating products for my patients back in 2021, and it's just evolved progressively over time, not knowing that these are all seeds leading to this world of beauty medicine, this world of aesthetic medicine. And I've gone through my own personal growth with my health, with my weight, with understanding who God has made me to be, appreciating who He has made me to be. And so to now find myself in this position wherein I'm given this assignment, create a med spa, build a med spa. To me, it's very humbling because it's really like, wow, all along the way, there were seeds being planted and I didn't even know. Isn't that amazing how God works? So tonight, let's talk about med spas. You may have heard the term med spa before, but I want people to know exactly what they are, why they exist, and how Rofi is going to be different. So we're going to call it MedSpa 101. We'll talk about regenerative medicine, we'll talk about aesthetics, and we'll also talk about preventative medicine. So for what it's worth, I know I do have some physicians or other healthcare providers who are on listening to this. The medical spa market is the full name, medical spa. It's actually valued over 16 billion. Actually, that was back in 2023, so it's definitely gone up since. It's projected to surpass 30 billion by 2030. Now it's worth noting that there's the medical spa industry, and then there's also the global wellness industry, which is an even bigger market valued at over $1 trillion. So if you do know that this is something you're interested in, I don't think money should ever be a driver for anything in medicine, even to become a doctor in the first place. And I will have 10,000 stories for you and reasons why that should not be a driver. But I do think it's worth bringing awareness because some people may never have heard of it even. So, in today's day and age, this generation of women, we're not waiting for disease to happen. We want to prevent it. We want precision care. We want proactive care. And so, what does it actually mean? A med spa. So, like I said, the full word is or the full term is a medical spa. It's a hybrid between a traditional spa, which you would typically go and see a massage therapist, for example, and a medical clinic. So it's a hybrid between the two, hence the name. Medical clinic plus traditional spa put together form a medical spa. And so, in the setting where you are receiving physician guided care or care from a designated healthcare professional and treatment, there's also an atmosphere that's created. It's relaxing, and there's typically more on the aesthetic side than you typically would find in a traditional primary care clinic. It's also not a beauty bar. Medical spas, excuse me, they do operate within a medical framework. What does that mean? There is clinical decision making. Your labs are looked at. um, your symptoms are assessed. Informed consent matters. Safety protocols are important and are actually weaved into the care that you receive. And depending on where in the world you are, depending on the state that you are, the rules and the regulations vary. And I think that's always important for me to state. But many people may not know, but I do have a pretty global audience. And that's just because of how life has taken me through different continents. So, within a true med spa, there will always be supervision by a licensed medical provider because anatomy matters, pharmacology matters. We're dealing with medications. There might be contraindications, and complications are actually a possibility. This is the part that we don't always talk about. But then you have shows like Botched, for example, where you see how things can go really wrong. Granted, that is plastic surgery, which is even more in depth. But for example, in the US alone, there were over 7 million Botox, so botulinum toxin procedures performed in the last couple of years in America alone. Okay. There are millions of dermal filler treatments which are done every single year. So the numbers are high. We're talking millions. And so safety standards need to be high. It's not about trends at all, but it's beyond that. It's also not just about beauty. This is a great place to go to optimize your beauty. It's not a place to go to become beautiful, because for whoever needs to hear it, you need to know that you're actually already beautiful. But it is a place where you can go to optimize the gift of beauty that God has already given to you. So a med spa can address issues like collagen loss, which actually declines about 1% per year after a person turns 20. Oxidative stress, hormonal shifts can happen as well. Inflammation is a huge one. Micronutrient depletion, this is where the IV drips come in. And then also having abnormal metabolic markers. So let's say your cholesterol is out of range, or your A1C, which is what we use for diabetes or pre-diabetes, is out of range. Understanding that the skin is an organ, and beyond that, there's this entire internal framework that's at play. So it helps to understand what's going on in your body internally, but it helps to really get to the root. Now, I love the approach at Rofi because it's not just about coming in, getting a quick fix, so to speak, but it's really about getting to the root of whatever is causing your disease in the first place. Labs are important. Everyone gets a personalized protocol. So we could do work to alter this, to work on the skin. I shouldn't say alter necessarily, but let's say you get a chemical peel, but your diet is not optimized. We will address that as well. So you get a personalized protocol in addition to the care that you're receiving or whatever treatment you're getting. Some of the services that you may find, you'll definitely find a lot of IV injections. Um, you'll get a lot of injections. You'll get a lot of IV drips. So you can get injections which are quick, usually 5-10 minutes, and you're out. But then you can also have a drip, especially for people who are very busy, people who travel a lot. And so it makes it a little hard to optimize your nutrient status, to be quite honest with you. And so that's very important. You can get chemical peels, you can get facials, you can also get PRP treatments, which is platelet rich plasma. This is a procedure in which a sample of blood is taken from the patient. It's spun in a centrifuge, basically to separate the blood. The plasma is taken and it's injected somewhere. Um, Plasma is great at regeneration, and it may work, it may not work. So I think that's always an important disclaimer to give, right? It's very good, and sometimes it's excellent at what it does. But I've also had situations in which some patients have come to me and said, doctor, it actually didn't work. And I'm learning now that PRP, it depends on what the root cause is. This is why I love the Rofi approach. Let's get to the root cause first before we throw a ton of procedures at someone. You could even get laser therapy. So the possibilities are truly endless. I think it's very important to recognize, but it's important that wherever you go, wherever you find yourself, you want to make sure that there's a clear reason why you're getting the treatment or procedure you're getting. The dosing is accurate. You want to make sure that if there are any potential contraindications, you've actually been screened for them. And then there's also an individualized protocol. So, for example, if you're going to get an IV drip, are you getting one for the whole year, or is there a plan? Is it going to be once a week, once a month, once a quarter? Which one are you going to get? Which macronutrients or micronutrients are necessary for you in whatever season of life you find yourself? So this is important, and this is how we practice medicine responsibly. Okay, so this is what I want you to know. Now, who is a med spa for? It's actually for everyone. I think men need med spas, women need med spa services. Everybody needs a med spa, to be quite honest with you. Most of the clients are women. I think women are just a bit more proactive at taking care of themselves. But I think if more men knew about the services that were available at a med spa and how they could help them, then I think more men would actually go to med spas. For example, there's one injection, glutathione, which I know helps men a lot. It can help certainly with liver detoxification, or the detoxification function of the liver, I should say. But there are also effects that can even help sexually. So these are things that if men knew about, I think they'll be more keen to even go and get such services done. So if you know that you have a brother, a husband, a father, it's not just that benefit, but it could be their hair. It could be that they're inflamed. It could be that they also have abnormal labs and they want to optimize their health. I actually find that when men commit to something, they actually low key form better patients than women. They're just good at sticking to whatever plan you give them, right? But as it stands right now, most med spa clients, which is over 65 actually of the clientele, is primarily women, usually somewhere between 30 to 55. But it's important to know that if you're postpartum, there are med spa services for you. If you're a cancer patient, and depending on the phase of your treatment, whether you're in remission, you're actively going through chemo, there's something for someone at every level. Busy executives and leaders. That's a big one. Why? Because your lifestyle, unfortunately, makes you prone to an atmosphere of inflammation because you're around a lot of oxidative stress. It could be mental stress. It could be stress on your body inflicted from frequent travel or limited sleep. Women who are going through perimenopause, there's a lot that can be helpful for you. And those who just care about longevity. So let's say you know that you want to live beyond 100 years of age and you want to know what exactly should I do or can I do to optimize my health, right? These are the things that you can literally start to get treatments, education, consultations, etc., as early as possible. So, someone said, my husband gets treatments to his under eye and he loves it. Oh, wow. What treatment does he get? I'm actually curious. Let me know. Men are more compliant. I agree. I honestly agree. I think when you have their buy in, they're genuinely more compliant. I think women are quick to make a decision or quicker than men to make a decision. But when it comes to compliance, I find that men, once they're sold, that's it. You just have to do that initial getting them in the door. But when they're in, they're in. So all that to say, if you're a man listening to this, know that there are actually services for you available at a med spa. And if you have a man in your life, make sure that you let them know, hey, maybe just explore what's available. Oftentimes, I actually find a lot of men are complaining about fatigue. You'll be surprised at what how helpful it could be to just have blood work done, see how things are looking, and then go from there. Okay. So that's that. Now, there's aesthetic medicine, but there's also regenerative medicine. A lot of what I do at Rofi is actually focused on regenerative medicine. It's not only about, of course, we want to look great, we want to look better, but we want to also prevent and regenerate, right? People are investing in non-surgical interventions. They want to know how they can help their cells regenerate. They want longevity focused care. And this is why the work that I do, I just love it so much, right? Because where their potential limits with simply getting a one-time treatment, if when you're on a protocol, you're literally changing your entire life around. Your entire life around. I was speaking to a client last night and they were basically saying that they had eliminated something from their diet. And they're like, there was a time when they would never have thought they could go through a day without eating it. But now they recognize they can't even picture themselves eating it again. And it has not been more than 3 months, not even. Okay. So know that there's some, I think everyone should go to a med spa. I think in an age and a day and time when people are so keen on self-care, this is what true self-care I think should look like. So you also want to think about safety, you want to think about responsibility. So if you're picking a med spa, make sure you go to a place that's taking a full medical history for you. They're reviewing your medications, they are checking your pregnancy status, checking to see if there's any potential history of cancer. If there is, where in the timeline for cancer are you? If necessary, labs can be ordered. And then monitoring. That's also a very big one, right? So some things may actually be contraindicated. So I think that's important. IV therapy, it's become very popular and it's great because it's like a trend, but it's also important to note that it's very beneficial. It can really help people with hydration. Some people are very low in micronutrients. It's a great way to replenish those, help people recover from fatigue, help with boosting the immune system as well. But dosing is important, making sure that the kidneys are functioning well and it's personalized. So, what works for one person may not be safe or work as well for another person. But it's important to keep these things in mind. So, being forward thinking as a med spa, you want to think beyond like lines, like wrinkle lines, forehead lines. No. What are the hormones like? What is the gut health like? Iron, B12, vitamin D. What is the inflammatory burden in this person? So I truly believe that the future of medicine, the future of med spas, looks like integrating um, metabolic health into the treatments which are offered, having personalized protocols which are based on labs, having concierge level oversight so that clients have more access to the healthcare professional, and even forming just more of a bridge and being able to really support women through all stages and phases. I'm really keen on pregnant and postpartum women because it's almost like every day as I do this work, I see more and more just how much women have to go through when they're pregnant and postpartum. And so it's imperative that they are actually supported. It's not about vanity, it's not about trends, but it is really about transforming, creating a lot of transformation. I had a cancer patient recently who received a vitamin injection. I won't say which one because it just varies. I don't want to say it. And, for her, it was necessary that she got this specific one. And basically, she was very happy. She felt like within 48 hours, her energy was significantly better. That's a big deal because this is someone who had gone through rounds of chemo and surgery and all the things. So it's important that when you know that you're going through quite a lot medically, you get support. And one of the best avenues for that is a med spa that does this. So I'm excited about Rofi. This was actually, we're going to get a lot more of this kind of content. I'm going to be literally breaking down the different kinds of services, products, etc., that you can find and get at a med spa. But this was just to lay a foundation to even say, what is a med spa? So I'm calling it Med Spa 101. I trust that you learned something new. And I trust that this will be helpful to every single person who listens. Thank you so much for tuning in, for contributing. Stay tuned for more. If you are not yet following the Rovi Collective YouTube page and my personal YouTube page, Larissa Assam, please make sure you do so. Additionally, this will be available on all podcast platforms. So please feel free to share, spread the word. Let's get people living healthier, better lives all together. Okay? Have